Yeah, we have another question which reads, how do we plan for second pregnancy if we are more than 30 years old? Okay, I would like to tell all of you that earlier days, no, they were thinking that about 30 years, about 32 years, it becomes too late for a woman to get pregnant. I would only want to tell you that the age limit for pregnancy, or where we are concerned about a mother gets pregnant, is now pushed from 35 years to 37 years. So there are plenty of reasons for this, because earlier time probably women used to get married like in early 20s, like 23, 24. They used to have their first pregnancy by 25, 26, and they used to complete their family, probably the second child, by 30, 31. But here nowadays, the years, like probably 5 to 10 years since 2000s, we're having plenty of women getting married only by the age of 30. So they start their family only by 31, 32 with their first child, and they invariably end up having their second child probably by 35, 36 years. And it's absolutely okay. 30 years is no longer considered as a higher age for any mother to become pregnant, for any woman to become pregnant. So don't worry about 30 years. All what you have to worry, if your age is above 37, is when you need to consult a gynecologist or a fetal medicine consultant as to what you can do prior to you getting pregnant. But I would like to say a couple of points which you need to have in mind before you plan to conceive. Let it be any age for a woman. Probably after getting married, say, we would usually advise women to get pregnant anywhere between 25 years to 35 years. That's the ideal time when the woman's reproductive age group, reproductive organs are the right way. Way too early, like 20 years, 21 years, and also about 37 years are at high risk of chromosomal abnormality. That's what plenty of research papers tell us. All of us think that only mothers who are aged like 38 years have a lot of complications. I would like to bring to your notice that young mothers who are around 20, 18, 19 years old face a lot of complications, both chromosome, genetic, anemia, and also nowadays the rising incidences of diabetes, thyroid, and hypertension. All these three are very much prone for younger mothers as well as mothers who are above 37 years. So both of them should be really careful. So the three things which I want to tell you prior to planning a pregnancy of any age group. One would be, first, periconceptional folic acid. The word periconceptional means prior to pregnancy. Folic acid is a multivitamin tablet which is usually given on your first booking visit when you meet your gynecologist on your first time after testing pregnancy positive. When you visit your gynecologist, when your test is positive, you're already 4 to 5 weeks pregnant. Only then you know that you have missed your periods. By 4 to 5 weeks of pregnancy, the baby has already split into forming its brain, spinal cord, hands, legs, heart, and everything. So when you take folic acid prior to your pregnancy, that is 3 months prior to your pregnancy, only then it will be beneficial for a healthy baby. That's one. The first point is folic acid prior to your pregnancy, minimum of 3 months earlier. Two, if you are a diabetic, or if you have family history of diabetes, or if you've had a previous history of diabetes in pregnancy, in your prior pregnancy, make sure you test yourself. Test HbA1c, your doctor would advise you on that, which will give you an average blood glucose level and also a fasting and a postprandial sugar levels prior to you planning for your pregnancy. 3. If you are a mother who's had prior history of hypertension, high BP during pregnancy, it's very, very important that you control your salt, your spice intake, and also you need to take care of your weight prior to conceiving the next time. Last but not the least, it's very common to mothers who have had thyroid issues during pregnancy. Your weight is extremely important, because when you start with a higher BMI, that's heavier, when you start your pregnancy with say 85 kilos or 90 kilos, you are very, very likely to touch 100 and above during pregnancy, because as you all know, easily mothers would gain like 10 to 15 kilos in pregnancy, if not anything less. Probably we start from 6 kgs onwards, 6 to 8 kilos, and for a mother who started from 80 to 85 kilos. So make sure that your weight is under control when you plan. That is optimal weight for your height, and that's called BMI. So if you enter your weight in kgs and your height in centimeters or inches, there are BMI calculators in Google available. Check out what your BMI is, make sure you're in the desirable weight for your height, and then plan for your pregnancy. Folic acid, check your sugars, BP, thyroid, and weight. I would want everyone to go through only these 5 things. Make sure that everything is done before you plan for your second pregnancy.